So being a physical therapist, I work with patients with disabilities all day long. When they're admitted to the hospital, lots of times they're in the bed for several days, they may have been in the ICU, they get quite weak. So we basically just help them learn how to function again. We teach them strengthening exercises, we build up their endurance, we help them sometimes just sit up in bed, get into a chair and walk again, and hopefully get back to the lifestyle that they were living before they came into the hospital. Lots of times it's important for a patient with diabetes to have their blood sugar checked. We want to make sure it's not too low or too high when we're working with them. Typically a safe range that we're looking for is anywhere from 100 to 300 for their blood sugar. If it's too low, we like for them to have a snack, preferably some carbohydrates with a little protein before they exercise. Other things I like to take into consideration if their diabetes is more advanced, sometimes it can affect their vision. So I'm going to take that into consideration, especially with their balance and making sure they can see obstacles in their path. Another complication of diabetes that we see a lot is people with peripheral neuropathy or sensation difficulties. So sometimes we just want to make sure they know, to check their feet regularly and to make sure they're not getting sores on them and make sure they have proper footwear and things like that before they exercise. Oh, there are so many ways people can be active with physical limitations. Ideally, you could just get up and walk. Like it's something simple that people do every day. Walking is a great form of exercise. For those people who are more involved and they're not able to walk, they could, look into going to a physical therapist to teach them some exercises that they can do, such as some basic strengthening exercises with weights or TheraBands. There are stationary bikes that they can ride. If somebody's in a wheelchair, they can simply propel their wheelchair, working on their arms and their legs and building up their strength. I recommend anybody with a disability to see a doctor or a physical therapist first before starting an exercise program. But once they're cleared to do that, there are a lot of different ways we can find for people to build up their strength and their endurance, even with the limitations that they have. Exercise has so many different benefits. It can help you sleep better. If you're diabetic, it can help decrease your blood sugar. It helps your energy, it helps your mood, it improves your circulation, it helps prevent heart disease. So having a disability is no excuse not to exercise. For me, it's an even better reason to exercise, to keep your physical functioning at a level so that you're not going to decline later on. So as far as how much activity you should get each week, the Center for Disease Control and Prevention recommends 150 minutes of exercise a week, which is about 2.5 hours. If you were asking me personally, I would say to do as much as you can tolerate. What I tell my patients is, if you can't do that much right away, then gradually work yourself up to that point that you can do that much. So start with walking down your hall and back, a few times a day, gradually work it up to going to your mailbox and back, then work it up to going down the street to the stop sign and back, and eventually you're able to walk around the block and you're able to do that amount of exercise. So if I have a patient that comes to me and they haven't seen their doctor, I always recommend that they do see their doctor before they start an exercise program. It's really important that they get a thorough evaluation of exactly what's going on inside their body, because there's a lot of tests that doctors can do that I as a physical therapist do not do. And I want to know what I'm working with, and I want the patient to know what they're working with. I want to make sure that we are safe and that we're working within parameters that we're allowed to work within, and then that we're not going to do more damage to the patient by doing some moderate or vigorous exercise. One of the reasons I love being a physical therapist is that I am helping people every day. The first time they see my face, they may go, "Oh gosh, no, not you," because they know I'm going to make them get up and I'm going to make them work. When I see a patient go from being on a ventilator in the bed and bedridden for days to then walking out of the hospital, it gives me such a great sense of pleasure. And I just love eventually when they come back and they didn't want me to come because they hated me, to come back and say thank you. Thank you for all that you did to help me. It really makes my day. So if people want to find out more information about Duke and the physical therapy department, there's a website, www.dukemedicine.org. And specifically for the physical therapy division and occupational therapy division, the website is ptot.duhs.duke.edu.